So the first step would be, usually coming into the clinic, I would have an introduction with history taking and a blood test on the day. And the blood test is quite comprehensive, including the general markers that we do, full blood count, etc. We do a C-reactive protein, which is basically chronic disease or cancer screen in many ways. We would do liver functions, but then we're going to a little bit level deeper. We do the uric acids, we do bone profile, we do the advanced liver functions. We do that. Endocrine system is a huge part of how we function. Remember, we in our specialty focus on that first 2 years of your training, anatomy and physiology. So we are focusing hugely on what can we identify is going wrong, how this work and system is actually performing. So we look at the endocrine system, including the testosterone, the dehydroepistenedione test. We do the FSH and the LH. We do the progesterone. We do pregnenolone where it's indicated. We do growth factors where indicated. We do the estrogen, obviously. Thyroid function, T4, T3, TSH. We're doing your vitamin basics, the vitamin C, the folic acid, etc. So it's quite an extensive blood test and profile and
this
a panel.
Is not a normal GP blood test.
No, that is not. So this is going beyond the level of just basic health screen, right? And people would ask me, say, would I have this done in a clinic doing a yearly health screen? Is this similar? Yes, it is possibly similar to that in many ways. And I'm not trying to play down on the value of health screening, right? And I think it's extremely important, and I would encourage my clients to continue their healthy, their yearly health screening. Continue that, absolutely. But at the same time, what those health screens do not do, and it's because it's a screening test, it observes for current disease. Now, here we're back to the whole thing of disease and disease management, and a lot of those health screens are designed to pick up something that you might already been suffering from.
Yeah.
We are in a field of how can we prevent anyone in the future picking up that you have this particular disease.
Yeah.
It's a different concept, it's a different mindset. So yes, we are focusing more on not what is going wrong in your system, but so much how healthy and how optimal is this system working of yours for your age and for your gender.
Yeah.
And we have markers where we have an idea of what it should be like. So we have a range. So let me immediately put you on that point to say, when we do the general history taking on the day, I'm obviously trying to identify already where are my future problems. Is it metabolic disease? Is it diabetes? Is it cardiovascular disease, cholesterol, whatever? And then I focus and redesign my blood panel according to that possible risk. Because we have now a much better understanding of genetic diseases, and I have to adapt my panel to make sure that I go beyond the normal to check how healthy is the system working, right? And this is exactly where we pick up on things going wrong very early, long before the diagnosis is actually clinically made or even made with a special investigation. There are indicators in our body that points to disease and disease development. We're in the business of preventing that. We're in the business of preventing a diagnosis being made.
I don't remember the exact source that he used, but I know Owen said something last week I really, really liked, and it was the absence of disease does not indicate the presence of health.
Exactly.
I think that kind of ties it up nicely. And are these tests, are they gender specific? Is it the same for men and women? Is the process same for men and women when they come in? Because I know obviously there are different considerations, but when you're talking about overall general health and wellness, is the process the same, or are there things you have to think about differently for men and women? And not just men and women, but also older people and younger people and people of different backgrounds and genomes and things like that.
Interesting enough, Dan, there's not much of a difference in the approach. It is exactly the same model we apply.
Politically now, to be very careful what you say. There's no differences between men and women.
So the The only difference really is here is that in the endocrine and hormonal systems, we are very different, men and women.
Yeah.
But guess what? For the rest of the systems, we're pretty much the same. So the biomarkers that we would use, the range and the widths of the ranges are different. Obviously, for every test that we do, that will be different in men and females. But at the same time, from an approach on how we manage the person coming in for a bioregulatory or functional medicine assessment is exactly the same. Again, the history leads me to design the panel, the blood panel. And according to the history, so I always urge people to come actually down with a little list on the day of the consultation, because you can't remember all the things that you wanted to ask. So come down with a little list. As you give me your history, I'm noting that, and I'm also starting to design the panel that I would think I already have in my mind by the time we are finished with the blood panel, that where are my focus points where I could possibly identify disease in the future developing. All right. So the better the history and the better reflection of the results of the blood panel, the more pinpoint my diagnosis or possible diagnosis for the future can be. Children, the same. Older people, the same. Obviously, in older people, we're looking at some different markers as well. We are more focusing on carcinogen or carcinoma markers, etc. In children, we are very much focusing on metabolic markers, especially if there's a bit of overweight already in the child. We obviously will focus a bit on that. Growth hormone in children are very important as well, and things like that. So it is. There's not a blueprint for every person. Okay. Every person coming in gets a very special blood panel and examination.